Welcome everyone to Coaching in Session. My name is Michael Rearden, and I'll be your mindset coach today. And today we're going to be talking about men's health and all the things related to it. Now, just because this is going to be a conversation on men's health, it doesn't mean that women are not going to be getting some value from this episode. Number one, if you're a mom and you have a son, you're going to want to watch this episode. If you have a relationship with a man, you're going to want to watch this episode because you're going to be getting into the mindset of what a man is going to be needing, what a man is going to be facing in our world today. And there's so many distractions. There's so many different paths that a man can take. Which one is the right one? And I mean, I can tell you which one might be the best option, but just because I think it's the best option, it doesn't mean that it's going to be his path because it's his life. He gets to live the way he wants. Sometimes men, they need that trial and error. They need to make mistakes. But then sometimes a man can look at another man and they can say, this man is doing well. How can I emulate what they're doing? And it's not that he's trying to be them. It's just that a man is going to look for a man at some point in his life to follow, whether it be a cartoon character, a person on a sitcom that even if they portray themselves as weak, or maybe a family member, uncle, brother, father. How do they represent themselves? Because if the father is overweight, smoking, doing drugs, what do you think is going to happen to that man that he's raising? That man's going to see perception. Does he see the father as this is what a man is, or this is not what I want to be as a man? And I tell you this, most men are going to look at this is what is a man, rather than I don't like the path he's going on. So if we know that to be the truth, then we know that we already have the cards stacked against us as men. We know that around every corner, we're going to be faced with an option: weakness or masculinity, femininity or masculinity. Not saying that femininity is weakness, but to a man, it is. A woman who's in her femininity is actually reversed. Femininity, power, masculinity, weakness. And so we can talk about that in the comments below. So if you have a question about that, comments below, hit that like button while you're going down there. We're going to be bringing on Dr. Truong, who's going to be a medical doctor who's going to be dealing especially with men and their sexual habits, behaviors, lifestyle, and helping them get into better health. And right now, we just need someone who's going to be able to educate us in the right direction so we can start to be better in our life. It might not seem like a big deal until we're older, but right now, especially if you're younger, you have an opportunity to change your whole circumstance in life. And this is simply mindset coaching. This is common sense. But the problem with this common sense is you have to know it and understand it for you to be able to apply it. So let's get into that conversation with Dr. Truong and start to learn how we can educate ourselves on men's health, mental health, and all of the above. Welcome, Dr. Truong, to Coaching in Session. How are you doing today?
I'm fine. Thank you for having me here.
Of course. And today I have you on as not only a doctor, but you help men with their manliness, I guess you can say. And we're going to really dive deep into that today. Without me kind of talking about your whole biography, please tell the world who you are, what you do, and how you help.
Well, thank you. I am a medical doctor. I'm Dr. Truong, and I've been in practice now for, good Lord, 25 years now, a long time. And my evolution, I was a typical medical doctor that give you prescriptions and prescribe, really procedures and surgery. And I feel that I was not helping my patient. That's when I started learning about acupuncture and more of a total body healing. And I started doing stem cell therapy, which is harvesting your own cells in your body to help you heal yourself. And then also adding nutrition, exercise, and lifestyle changes to really optimize your healing. Because by nature, I'm a pain management doctor where if you have back pain or knee pain, I will help you heal yourself to do everything you can before surgery. What that gave me was a sense that I need to heal the person from the inside out in order for them to heal their condition. Over the years, I have evolved to concentrate more on sexual health because I feel that sexual health is such an important disease and issue that's not talked about, and not a lot of doctors know how to treat it. Not a lot of patients know how to address it other than going on Google, and they're being misinformed and misled. That's one of the reasons why it's my mission to educate and inform men and women about their sexual health, because if you have good sexual health, you will have good general health as well, because sexual health aligns with heart health, which is really what it's all about. Because as you get older, people die or have disability from having heart disease. So it's not about talking about the bedroom and like that. It's really about maintaining your sexual vitality, which then will translate into longevity and general wellness. Not a lot of people know about that. They just, focus, oh, what's going on in the bedroom? I want to get, on the bedroom, but they're not seeing the long-term impact of maintaining that sexual vitality. So that's why I started my podcast channel, YouTube channel, and I wrote a best-selling book on Amazon, Erectile Dysfunction Fix. You can see behind me here. And my goal is exactly like what I just said. It's really to bring the message out there that you can have sexual vitality for life, and that as you get older, you do not or have decreased sexuality.
Mm-hmm. Yeah, sexual health is one of those things that many people put under the rug, right? It's kind of the things that they don't worry about. They think they have to perform a certain way. It's actually a critical component to any healthy relationship, where I think many people are so worried about how much money he makes or what type of car he has. When they finally start the relationship, they're not compatible in bed, maybe. And maybe he feels that he's a certain way because maybe he only lasts 5 minutes, and then she feels a certain way. There's a stigma on sex and relationships too. I think we put a lot of focus on attaining a relationship, but then we don't look at the ins and outs and the inner workings of a relationship. Like maybe the sex is not good, right? Or maybe the sex is not what the other person was thinking. I mean, we can go down that rabbit hole of that. But one of the conversations I wanted to have with you today is the ED portion of it, right? The erectile dysfunction. I wanted to talk to you specifically about what's going on in society today. And right now in society, we are portraying men as weak. We are portraying them as more feminine. The foods that they eat maybe might lower their testosterone. Porn has been a huge crutch in our younger teens and even our later teens and our college adults in their early 20s, where they're using porn and they're getting this idea of what sex is. So they learn from sex, not from a personal wellness class in high school anymore. It's now, how can I learn about sex? And typically their friends are not going to talk about it. So they're going to talk about it, maybe in and out, saying, oh, I slept with this girl, that girl, but it's not about, okay, well, what is like the detailed facts that happen. Is more of, okay, well, I'm going to watch a porn website and that's what they do. So they get this misconception of what sex is. Then also that can also lead to ED because they have this perceived value in sex of like, oh, sex has to be like this. But when they maybe have a partner, is not that. So in your experience, what do you think is the main culprit for erectile dysfunction in our men today?
Wow, that's a very general question, but I'll try to kind of pinpoint the top 5 or 6 contributors to ED. What we're seeing right now is that ED is appearing in younger men. ED used to be a problem with older men. The reason why now, and I'll just start with older men first and backtrack to younger men. All right. The reason why, you see EDs around when men are around the 50s and 60s and 70s, there was a large study that was done in 1999 that looked at a large population in the U.S. The Massachusetts Sexual Health Study. They found out that men between the age of 40 to 70, 50% of them have ED. That's a large portion, 40 to 70. Half of the men that have ED. All right. And that was a study that was done like almost more than 20 years ago. I think that number now is a lot higher. Let's start with the older men. Why is ED more prevalent in older population? But because when you get older, what happened? You gain weight and you may not have the most healthiest lifestyle. So you start having high blood pressure, you start having high cholesterol, you have diabetes, and your testosterone level go down. Testosterone is what makes a man. It's a hormone. Starts going down and you just not as active. So all those factors of high blood pressure, high cholesterol, diabetes, obesity, those main things, and smoking, if they are smoking, all can kind of cumulative over the years that contribute to ED. And that takes like a decade or so to happen. So that's why you see that more between 50 to 70 or between 40 to 70. All right. So what are the main factors of contributing to ED? Smoking is one thing. Doesn't matter if vape or cigarette is smoking, or even eating it is smoking, nicotine. And then two is diet, your diet. All right. Meaning what you're eating. If you're eating a lot of processed food, a lot of junk food, red meat is actually harmful for men, actually, because red meat, the more red meat you eat is more inflammatory and it dries up your blood sugar and dries up your cholesterol. So red meat, even though a lot of men like red meat, and red meat actually help with your testosterone after a while, but too much of it becomes inflammatory. So when I say red meat, it's like the hamburgers, the steak, and mashed potatoes every day, and processed food and chips, French fries. Okay. So it's a smoking, diet, and then sleep, not getting enough sleep. Like you should have between, 7 to 8 hours of sleep a night, and between 10 p.m. to 6 a.m. Because when you sleep, that's when your body heals. And when you sleep, that's when your body makes more testosterone for men. So it's women too. Women's the same way. We make our hormones when we're sleeping. So when we're not sleeping, our body's not able to heal. Our body's not able to make the hormones that it needs. All right. So that's number 3. And then number 4 is exercise. Why is exercise important? Because when you exercise, blood starts flowing in your body easier, and you open up the blood vessels in your body. We have about 25 miles of blood vessels in our body. And if we don't exercise, those blood vessels get hard, and it's hard for it to expand in and out. So when you're exercising, you're training your blood vessels in your body to expand, contract, expand, contract. Why is that important? Because when your blood vessels open and contract, that's the way that blood flows into the penis, and that's how you get an erection, right? So if you're not exercising, you're not inducing that blood flow and that training of the blood vessel. The other condition I talk about is high blood pressure and high cholesterol and diabetes. But those 3 conditions all relate to what? If you're not exercising, or if you're not eating well, and that make you gain weight, that's contribute to high blood pressure, that contribute to high cholesterol because you're not eating well, and diabetes because you're not eating well and you're not exercising. But the main thing what I had just stressed was all those factors I just mentioned are modifiable and reversible. All right. And testosterone actually will decrease more accelerated if you don't modify these conditions. So testosterone, yes, it decreases a little bit after the age of 35 by 1%. However, by the time you're 50, it's only decreased by 15%. But if you exercise, eat well, and sleep, you can actually moderate the deceleration of the loss of the testosterone. So those are the common factors. And that's why older men tend to have ED. Does that make sense? All right. So it's just not because you're old, the age have put you at ED. It's because when you get older, you have these medical conditions which contribute to ED. Now let's backtrack a little bit to men, to younger men, and why we're seeing men in their 20s, mid-20s with ED. So when men in the mid-20s, they're very healthy, right? The things I mentioned was smoking. Smoking is choking your erection. If you're smoking, you might as well just grab your neck and because that's going to happen to your penis when you're smoking. It's not getting enough oxygen, not getting enough blood flow. And that's the same thing with vape. As you know, vaping is more common now in younger population now than it was before. Supposedly it's supposed to be safer, but recent studies have shown that the vapors is not that much safer than cigarette. But that's another issue. So I mentioned smoking, sleeping. Right? Sleep, you're not getting enough sleep. And then also a diet. Diet is the main thing, because the penis, when it is in an erection, it expands to 40 times more blood vessels than at rest, than it's flaccid. So when it expands to 40 times more blood vessel, what is it most sensitive to? It's sensitive to what's flowing in your blood. So what you eat is what gets exposed the most in your penis, and therefore if you eat inflammatory food like red meat or French fries followed by a Coke, that's inflammatory to the lining of the blood vessel. But which organ had the most blood vessels when it's directed to your penis? So that's why it's more effective. And that's why it's affected by diet. So those three things. And then, there's more porn now on the internet. Is more streaming is more accessible now than ever. When I was growing up in the 80s, the only thing you have is the Playboy magazine or DVD, right? But you have to go get it. But if you're young, you can't get anything. You don't have the access to internet like we do. Now you can get this on your phone. You get, it's ever easily accessible. And porn is easily accessible as well. And, excessive porn. So, I mean, like daily, between, 4 to, 8 hours a day of that as well. So that's why we're seeing more in younger men with ED because of those lifestyle factors that I mentioned. But they can be reversible, actually. The reason why porn contributes to ED is because it resets the mind, because you're not getting stimulated by a real person anymore. You're getting stimulated by something on the screen, which is entertainment. Porn is entertainment. It's not real life, it's what we see in Marvel movies, right? It's entertainment. Sometimes individual can interpret it as what real life should be, but it's entertainment. However, the more that you get, you're going to what they call desensitized, or you're not getting aroused or stimulated by being with another person other than what you're seeing on the screen. But I try to keep that very simple because that's another topic we can get into. But the reason why, to address your questions, why is ED more prevalent now than before is because of those lifestyle factors that I mentioned. It's more prevalent in younger men. And then when you get older, you can start having high blood pressure and high cholesterol and diabetes. But what men don't know is that you have control of your sexuality. You do have control of your by what you eat, by your exercise, how much you exercise, by how much you sleep, and what you do with the lifestyle factors. Like smoking, drinking. Yes, excessive alcohol contribute to ED because it's inflammatory to the blood vessels. Anything that's inflammatory to the blood vessels contribute to ED. And how much alcohol? Everybody's asked. Well, I would say probably between no more than 10 or 14 drinks a week. If you think about it, that's about 2 drinks a day. You can do, if you're a weekend drinker, that's your allotment. But if you do it every day, because alcohol is not innate to your body, meaning we don't produce alcohol. Alcohol is considered synthetic or foreign to your body. So when you drink it, your body have to process it and break it up into a form that it can recognize. So your liver have to work so hard to churn the alcohol into a substance that your body can take. So that's why after a while, your liver gets inflamed, right? You start having fatty liver and you start having cirrhosis, which is scarring of the liver, because the liver is working 24/7 to try to filter the alcohol in your body. That way your body can recognize it. So it's a foreign substance, essentially, when you drink alcohol. I mean, I'm not to tell you, I like my glass of wine as well. And I had my glass of Chardonnay, last night. This is just stating the fact, non-judgmental, just stating the fact of what we know at this time. But the main thing I want to stress is that men, you do, and women, you have control of your sexual vitality by how you live your life, and that you can modify this. So when you do have ED, take a few steps back and say, okay, all right, what am I eating? All right, what am I eating? Am I exercising? How many hours am I sleeping? Am I smoking? How many drinks am I drinking? If I am drinking at all, what's my stress level? Those are the things that I want to impact upon men and women. It's just before you grab for that little blue pill Viagra or Cialis, take a few steps back and do some introspection and what's going on and what you're doing that may be contributing to you not performing as well. So most men will notice that, hey, I'm not as firm as I used to be. Maybe it's taking me longer to get firm, or maybe I lose my firmness, before I finish. Well, instead of going on Googling and trying to take a Viagra, Viagra is a $9 billion business. All right. It's because we're so used to trying to take a pill for a condition where we really can cure yourself. That's my whole point, is that you can cure yourself. That if you have ED, you can take a few steps back and just look at what you're doing. I see my patient. I know that they have ED, and then we will talk about, okay, what you eating do, and if they change their diet, some of them just literally, if they just, will go from eating red meat to eating every day to maybe once a week or maybe twice a month and stop the sodas and stop the French fries. They are telling me within 6 weeks that they're noticing a difference and that they're firmer and that they have better sleep. And all they have to do, during the day is just go for a walk. Everybody said, well, I don't have time to exercise. We have time. Is it important for us, right? Is it important for us? We'll make it happen. Even if it's just 30 minutes or even doing a Zoom meeting, stand up and start walking in place. And one thing I want to mention is that we're starting to recognize more that if you're sitting a lot, like you're sitting, working at home virtual for 8 hours or 6 hours at a time, sitting actually kink the blood vessel and make your blood vessels from your heart that goes down to the genital region. It makes it almost like turn a 90-degree angle. So when it turns like a 90-degree angle, it kind of decreases the flow. So men, if you're sitting for work and you're doing virtual, just try every hour, try to stand up, move your leg, walk in place, just to get that flow going down to your legs. So that way you're not kinking the blood flow down to the genital area. So, the whole point is don't grab for that blue pill. It's kind of like weight loss. I compare ED like weight loss, right? When you trying to lose weight, what do? You look at what you're eating, right? You correct what you're eating. You're trying to exercise and you stop the bad habit. And once you lose the weight, what do? You have to maintain it. You don't revert back to what's causing you to gain the weight. You have to maintain the lifestyle change that you did to lose the weight. And it's the same thing. It's the same thing for ED as well.
You touched base on so many topics there where it's like, how can I unpack it all? Because this is so much good content there. The first thing I want to talk about is the idea of time. We all have time. You might think you don't have time, but I can guarantee you that we can create some time in your life. And I know people that will come to me and they'll say, Michael, I have no time. I have kids, I have work. And I said, okay, well, let's write out your 24-hour time block. And then from there, we figure out maybe you have maybe 4, maybe 5 mandatory things that you have to do. And then I asked, do you still have no time? And they're like, no, I don't have no time. And then I basically say, okay, well, go through your week and you tell me where you start messing up the schedule, because we only have the 5 important things on the schedule. So that means if you're on your phone doing whatever you want to do, whether it's be on YouTube, TikTok, Instagram, social medias and stuff like that, are you looking for entertainment during your day when you're supposed to be working, right? Because that's the allotted work time. What are you doing? And then from there, if you're not doing that, what are you doing to build yourself up? And I talk about that a lot on the podcast, because I think many men just think, because we're given this idea of what a man is from social media, from sitcoms and TVs and things like that. And there's been a study done. If you look at the men that are on these shows, they're portrayed typically in a weaker value. So now men are seeing men, oh, this is how I should be acting. And what is happening is that men are going to look for a man to emulate. So if they only see weak men around them, oh, I guess I have to be this way. So if the person that they're watching on TV is obese or overweight, then the man is like, oh, well, I guess that's normal. So then they don't use the idea of health and fitness or making time for their exercise a priority. When I work with people, one of the first things I tell them is, how can we get more energy? How can we be more active? Because oftentimes they're very lethargic. So it could be the foods they're eating. They're not exercising enough and they don't have the right mindset. So all of that plays a pivotal role in how we act in our day, because if we don't have to show up, we won't show up. And most men don't show up because they have the freedom. Oh, well, like I want sex, but I can just turn on some Pornhub or whatever. They can get that fixed, right? And it's one of those basic needs that we need. So sex is one of them. If we can get it from a screen, men are going to do that before they go off and put themselves out there, be courageous, risk a failure, because they, they're so nervous to talk to a person. Whereas like you see a pretty girl, maybe at the bar or somewhere, or even on a dating app, and you don't know how to communicate with them. And we have lost that cordiality to be able to speak to people, to be open-minded, and to understand what a masculine man is. And I mean, luckily, I had great role models growing up where I wasn't really looking at the TV and the sitcoms for how to be a man. It was, okay, I look at my father, I look at the teachers that I had, that were men. And I can see that they're working out, they're buff, and they're doing everything that they're supposed to do. And I remember when I was like 18, I was still going to Planet Fitness at the time. I don't go anymore because they don't have like free weights. But either way, there was a man. He was, I think, almost 70, or if not in his 70s already. He looked great. He looked better than me. And I'm 18. So I was like, man, this is crazy. And so I asked him, and he was like 70% nutrition, 30% working out. And I was just thinking in my head, because I'm 18. So I'm thinking it's all working out, right? So I'm just like 18. All right, I just got to go to the gym. So he's like, no. It's more nutrition than working out. And I think many people, I don't think they look at that nutrition part. They don't pay attention to the foods they eat. They go to the store, they get their chips, they get their sodas, they come home, they play video games, and they don't even know how much they consume. So they're just in that habit of eating all this junk. And then they wonder why down the road there's a problem. And the problem is our habits. So those habits are not conducive to being in a better body, having better sex, better relationships, better life overall. So the mindset is so important, because if we just keep going down this road of, okay, well, I'm looking at these TVs and this is what a man is. I'm eating these foods that are not healthy, whether it be the red meats, the heavy carbs, French fries, potatoes. All of that stops us, slows us down. So we have to learn how to get into a better way of thinking. What is your recommendation for helping these young men who are listening to this, or maybe even women who have children, sons that are in their younger teen age, that are going to be eventually teens? And right now, again, these teens are going to be looking around them. So if your husband, woman, I'm talking to you, if your husband is overweight, weak, maybe he has high blood pressure, there's things going wrong, your kid, your son is going to be looking at your husband, and they're going to emulate that, because if they don't have a good role model, they're going to need one. So what would you tell someone that maybe is in their younger teen years, getting ready to go off into the world, and there's so many distractions going on? How can we focus them to look at the better part, to be better?
That's a great question. It's simple, honestly. Think about when we were in early 1900s, before TV started, even before the cell phone existed. What do we do? What do we do? We go outside. We go outside and we socialize, right? The phone wasn't even very readily available. I can tell you, when I was a kid growing up in the late 70s, all I had was just a landline. I didn't have a cell phone. So what I'm leading to is, when you're young, enjoy nature. Because when you go outside in the morning, the sun will reset your circadian rhythm. Just the sun in your eyes will help you reset your circadian rhythm. What that means is that it helps you be more focused, give you more energy through the daytime. And then at nighttime, it helps you sleep. Just being outside itself is healing for you. And the reason why I'm saying that is that we don't go outside that much anymore, right? We wake up, we go to work, we get in our car. You get maybe 10 seconds of going from your garage to your car. My garage attached to my house, I don't even get exposed to the sunlight. And then you go from the car to work, right? You're not outside anymore. You're not enjoying nature. Nature is part of who we are, and part of really your mind and your body and soul, because when the sun touches your body, there are chemicals that happen from your eyes that go to your brain that sets up your hormonal milieu, which then help you with your circadian rhythm, which help you with sleep, which help you with being focused. So you may not even need that coffee in the morning, or that coffee at 1 to 3. So the main thing is, try to go outside as much as you can, and minimize the Game Boy, the gaming. I mean, that's what young men do, right? They spend hours, in front of the computer playing video games, right? Minimize that. Go outside. And the second thing is, eat healthy, right? Eat healthy, because when you eat, what does healthy mean? Because I don't want to go into macros of carb and so forth. What does healthy mean? Eat anything that is not in a bag, that is not in a box, and decrease red meat. If you're getting something that you have to tear a plastic bag for, then you shouldn't be eating, because that's processed, right? And I know when you're younger, you eat what mom and dad, cook for you. But, don't eat chips, and try to avoid the fast food stuff. But it's so unfortunate because where I live right now, I'm like 2 miles away from a high school. And within the half a mile perimeter of that high school, all you see are fast food restaurants. All you see, the Wendy, the McDonald's, the Burger King, the Wings place, Popeye, all surrounding the high school. And they have about 2,000 students there. And you wonder why, these young individuals are picking up the fast food habit. Yes, this fast food is easy and it's tasty, but in the long run, it's going to be inflammatory for you. So start eating healthy. And just what's healthy? Anything in a box or a bag, stay away from it, and just kind of, minimize the red meat. So go outside, enjoy Mother Nature, less gaming, eat healthy. And sometimes you don't have to go in the weight room to try to buff up so you can look good for the girls. I want to caution young men that are from between 13 to 18. If you will go in the weight room and work too hard and try to buff up, you're going to stunt your growth, your height. Because when you do that, you're going to restrict growth hormone release, which will affect your height. So you want to exercise, but things like soccer or tennis or basketball or running, things like that. But those sports are good because they also help you socialize as well too. Right? If you don't like to be in a group or you like individual sport, you can do running. You can just lots of other things like lacrosse or whatever. That's what I mean by being outside, enjoy the sports outside, even bicycling or even walking or hiking. Because when you're doing all that, you're exposing yourself to the sun. What happens when you do activities outside? You go home, you're exhausted, right? And you have no problem sleeping, right? No problem sleep. And when you're outside, you're not in front of the computer. You're moving. You're moving your arms and your legs, and your mind is peaceful. You're not thinking about what's going on in anything, and you're not in front of a TV. So those simple things, doing stuff outside, doing sports that involve other socialization and eating well, and make sure you have enough sleep. I know when my kids were younger, that was the first thing that they don't do well is they don't sleep well. They go to bed at 1 o'clock, they wake up at like 7. Because when you're a young man or young woman, your body releases growth hormone and testosterone when you're sleeping from 10 to 6 a.m. If you're not sleeping well, those hormones will not be released in full capacity. So you got to have that sleep. You got to have that sleep because you don't have that sleep, you're going to wake up tired. You're going to wake up tired. You're going to grab for that coffee. You're going to grab for that Red Bull, and then you're going to drink the Red Bull all day long because you're tired. And then on top of that, you're eating the hamburger, the French fries, and then the Coke. And then in the afternoon, you drink another Red Bull. And then you find yourself having a crash at night, right? Because you don't exercise, because you feel tired, because you don't exercise. You go home and then, you just feel exhausted. Well, what you're doing, you're taking your body to peaks and troughs, like high, low, with your blood sugar. Your blood sugar should be steady. That's another point. But the main point is it's as simple as that, go outside, do stuff, hiking, simple stuff like playing sports, less TV, moderate your game hours, and sleep well, and watch what you eat. Simple things like that. Even if you just do one or two, it'll make a huge difference. And watch your weight. Like you said, we have an obesity epidemic in this country. 2/3 of Americans are overweight. And I think it's because we're just sitting down too much. We're just too sedentary. With technology and computers and gaming. When I go to Europe, I don't see that. When I was in Europe, a lot of people were walking, and 2/3 of the people I see were not overweight when I was in Europe. And so I think that controlling the obesity epidemic will also change our wellness as well as, sexual vitality. But like I said, sexuality correlate with, general health as well too. So, I know that when you're a young man, you just want to attract the girls or just look good. And then you try to take shortcuts. Looking good and so forth really starts within yourself and setting up good habits. Start young. And I know you know this because you have mentioned it. You start younger, it'll become a habit throughout your whole life.
My dad, I think he told me, don't start working out really until I was like 16. So like 16 was when I started working out, but it didn't mean that I wasn't outside riding my bike, going out with friends to the park, playing all day, all evening. I was on the basketball team, high school volleyball team. So you can be active. You don't have to be buff and fit, like have all these muscles. Now, when you're a little bit older, if you want to add a little bit more size, you can do that, right? But then you have to ask yourself, how do I feel? And I remember when I was in my 20s, I was testing out different weights. So I think I was 190 to 200. And I said, let me go to 210, see how I feel. And so I gained the weight to 210 muscle mass. And I said, I don't like how I feel because it was a little bit sluggish for me. So I said, I don't like this weight. So I went back to 200. So my goal weight at that time in my life, in my 20s, was like 200 to 205 max. I didn't like being over that. I found 210 wasn't my number. But as I grew up and now I'm in my 30s, I was like, where do I want to be? Right. So now I'm in the 215, 220 mark. And I actually enjoy it now, but I didn't enjoy it before. So it's like different stages. I'm starting to realize like, okay, I'm enjoying this, but it's also helping me be aware of my body. I'm always constantly paying attention because if I don't put good foods in my body, like I'm eating the fast foods, I feel like crap in the gym. So it's like, okay, this doesn't feel good. I feel crap in the house, like where I'm like trying to do work, but I can't focus. I mean, it could be like, okay, well, you need more coffee. Well, I don't drink coffee at all. So it's like, why do you need coffee? Why do you need these energy drinks? It's because it's a habit that we were developed into. You think you need this coffee. You think you need this bacon, egg, and cheese in the morning when, to be honest, I mean, I fast in the morning. So I will typically break my fast in the afternoon. So I go work out with no food in my belly. And then from there, I allow the workout to burn some extra calories after. And then when it's finally lunchtime, then I break my fast. That's just me, right? But you don't have to do what I do because you have to figure out your body. But what I will say is that we have a lot of habits that are not really good. If you're drinking coffee with a lot of creamers and sugars, that's not a good habit, right? If you want to drink black coffee in the morning, by all means, go for it. You don't necessarily need it. When I first started like really understanding like the fasting, intermittent fasting idea, I was drinking lemon water in the morning. So I would wake up, I would have some lemon water, and that was all I needed because I was trying to teach my body that I'm not hungry really. I might be thirsty, and sometimes our body just can send wrong signals saying, okay, you're thirsty, so you're probably hungry. But after I was drinking the lemon water, because lemon water will quench your thirst and it will also satiate your hunger. So we learn all these little tricks here and there, and then we start to implement it. Yes, there's a fast food joint at every corner. It's hard to get away from it, but you have to understand something about fast food. Fast food is going to make you slow later on because you might be young right now eating this fast food, but later down the line, you're going to be overweight and you're going to maybe have high blood pressure. And that could lead to diabetes and other things that are going to slow you down. And you said something early on that was great, right? We can reverse this. It's not too late, right? We have to get into the idea of we know we can make some changes in our life, but we have to know how to make those changes. How do you help men and women make the changes to a better life and to get into a better mindset when it comes to lifestyle?
Education, just to let them know that they are in control of their wellness and the situation that they're not a victim and they're not a victim of their genes. You say, well, it's in my genes, no. I mean, your genes are the bullet, is in the gun. What you do with your lifestyle, with your life is what pulled the trigger. Okay, so your gene does not make you a victim in a lot of sense. And it's all about what you eat, your environment, and what you do with your lifestyle. And I want to empower them to know that you are in control and that you can reverse and optimize your health and your sexuality. You don't have to be dependent upon this pill. But we live in a culture right now that, you get gastric bypass. I see some patients that are like 50 pounds, maybe 70 pounds overweight, they get gastric bypass. And they lose the weight in about a year. And then a year later, they gain all the weight back. But when you get gastric bypass, there's no intervention on eating habits or lifestyle changes. So what I'm trying to lead to is that things that are important, that are good for you, you have to work on. You have to work for it. You have to put in the time and the dedication to work for it. It's like having a business, right? And it's like going to school. You have to work at it to get what you want. It's the same thing. It's not, you can't get your sex life back if you just take a pill. It's like almost like if you have diabetes, well, let's take a pill The pill doesn't make you not have diabetes. The pill just control the bad side effect that's going to happen if your diabetes is uncontrolled. But you still have diabetes. And I can't tell you how many times the patient comes in to see me and go, oh, I don't have any blood pressure. I take blood pressure pill. My blood pressure is good. My blood pressure is gone. But you're taking a blood pressure pill. It's still there. The blood pressure just control the side effect that the blood pressure can kill you. But if you maybe lose weight and watch what you eat and exercise, your blood pressure will go down. So what I see when I'm treating patients for their sexual health is that when they eat better, they exercise, and they sleep better, and they change their lifestyle, they're able to get off of their blood pressure medicine, off cholesterol medicine, even diabetic medication. The blood work absolutely changes within about 2 months. When the patient comes in, their cholesterol is high, the blood pressure is borderline, and the blood sugar is high. And so when your blood sugar is high, that means that, you're a diabetic. But with these changes, within 2 months, it's normal. So your body is very plastic. It will do what you want it to do, and you are the boss. You really are the boss. You just have to let your body know that you're the boss. You're listening to me. You're not going to dictate. Your body's not going to dictate to you what you can or cannot do. And it all starts in small steps. We live in a world where we press a button and things happen. It doesn't happen within a second. It's too long, right? But, our body is, thousands of years old, or at least, 100,000 years old. So things take time. Your body doesn't really change until like 6 to 8 weeks. It takes time, but take many steps. So I would advise you that you are in control and get together, go with somebody that can lead you and guide you in the direction that you need to do and knows the way to show that. And because, I coach men with sexual dysfunction on how to regain their sexuality back when they have sexual dysfunction, such as ED, and our membership, the Modern Man membership. I call it the Modern Man, like you said, it cut the modern man to 21st century man. What is that man? That man is the person who knows himself, that wants to live a happy, productive life, right? And it, like you said, what we see in media now, it's a totally, sometimes even confusing picture as well, too. And the modern man knows that what he wants, and he's comfortable in his own skin, in his own body, but knows that he needs to put in the work to be in his most optimal physical and mental shape as much as he can. And it doesn't take a lot, honestly. If I see by looking at you that it doesn't take that much. It doesn't take you going to the gym 3 hours a day, right? To do that, it really just takes have a good morning routine and a nighttime routine, and just a habit that you do every day. So my big advice is that take many steps and just go forward and know that you are in control of it, and you don't need those medications. Because I have seen my patient come in with 5 different medications, and as they work through just simple things, like I just mentioned, diet and exercise and the sleep and decreasing stress and stop smoking, they get off of their medication. I can tell you, I saw one of my patients I saw like 2 months ago. When he had ED, and he's in his mid-30s. He was smoking a cigarette and marijuana and recreational drugs, was also taking multiple medication for anxiety, and was drinking alcohol almost every day. After our consultation, and I told him about the different factors that can lead to his ED, he went cold turkey, stopped everything. And after our treatment, I also did some other treatment for him as well to restore blood flow. Now, 2 months later, working well. Things are working well. He's not on any of his anxiety medication at all, and stopped smoking, stopped drinking, stopped all the bad habit. And he now just met a partner that that he's very interested in, and they're having a productive relationship right now. And so what I'm trying to say is that things can change within about 2 months, but you got to make the mindset that you can do this.
Exactly. And there is no quick fix. We have to go on that journey. We have to do the steps, the proper steps, not just taking a pill, getting a Band-Aid. That's not the result. We have to really seek some change. And whether you do it alone by getting the right education, or you do it with a doctor, do it with a coach, they're going to be there to help you make sure that you're doing the right thing, that you're on the right path. And the work that Dr. Truong does is going to be helping men and even women get on that right path, to think in a better mindset. So, Dr. Ann, can I please get any final words from you? And then please tell the audience where they can find you.
Thank you. The final word is that you can have sexual vitality for life, and it starts with simple things. And all you have to do is decide that, yes, I want it and I can do it. My main website is www.truongrehab.com. It's spelled TruongRehab. And if you go on my website, I have a free ebook that will give you the 5 common mistakes that men with ED make. And it's a great ebook. If you start with that, that can be on the road. I also have a membership called the Modern Man Membership, where I coach men with sexual dysfunction, mainly erectile dysfunction, regain back his sexual vitality the right way, not with medication. And you can find that at www.mensexualityclub.com.
Perfect. And I'll put that link in the description box below, along with any other social media links that you have, because this is a problem that many men are facing, and it is very fixable. So the work that you do and the things that we talked about today are going to be very important. And I know many people are going to find this conversation that you and I had today very valuable. I want to thank you so much for coming on, Dr. Ann Truong. Great conversation today.
Thank you.
I would like to thank my guest again, Dr. Ann Truong, for coming on Coaching a Session. She is a wealth of knowledge, a wealth of wisdom. And there was just so many things I wanted to interject into the conversation, but I knew I was going to have an opportunity to talk about that after the interview had been recorded. So what I wanted to say is, yes, it's so simple for us to get into a habit of choosing weakness. We don't have to cook healthy foods. We don't have to eat the right foods. We don't have to work out. But if you do, what happens is amazing. You feel amazing. And I think so many men, they just get into this habit of, well, this is what I'm allotted. This is what I do. But just because you were allotted that, it doesn't mean you have to stay there. Many people, they stay in their circumstances. And I'm telling you, you don't have to stay in your circumstances. You can change your whole entire life. So if you have a bad father example, you can change that situation for your son. If you have a boy growing up who's going down the wrong path, how can you get him on the right path? It's all about mindset. It's all about creating the habits for your life. And it's all about knowing when to push, when to not push. And I talked about it in the podcast. I started working out just before my 16th birthday. And from there, I was able to grow and I understood my body very well. But then I always created the habit because I can look at my father, and when he stopped working out, what happened to his body? And I could say, well, I don't want that to happen to my body. Perception. I'm not going to get to my 30s and say, well, he stopped working out. I'm supposed to stop working out too. I understand that when I work out, I'm going to get so much more. And I remember I was just talking to my wife about this. I was like, I'm going to build a gym in the house, right? I'm going to get a whole room that's just dedicated for the gym. And I was thinking that like I'm going to have to build a house with just a gym. But then I said to myself, what good would that home gym do? And it wouldn't do much for me because Dr. Ann even said it. You have to get out. You have to leave the house. Similar to how if I'm in the office all day, I can be behind this monitor all day long, but it doesn't mean that this is good for me. Yeah, I might be filling up my bank account, but am I filling up my life? And I think oftentimes people get things misconstrued saying, oh, they have to do this 9-to-5 in their office behind a computer all day long sitting, but not standing or walking around. And there's going to be some people who get up and walk around, but for the majority of people, they're going to sit in that office, sit in that cubicle and not take action. And they're going to eat more than they need. And from there, they're going to start packing on the weight. And then it becomes very difficult because yes, you can easily get into the habit of wanting to get into shape, maybe even getting surgery to get into shape. But it doesn't mean that you're going to keep that type of result. It's all about mindset. Many people who are going to be starting off this year, they're going to be going off into the year very strong. Oh, I'm going to change my life. I'm going to change my life. And they might make changes, but do they keep those changes? And what happens when you don't keep those changes is that you reinforce what was happening. Similar to how we change our mentality when you're watching porn, when you're looking at these TV shows on how men are portrayed, you see what is right. And this concept goes for women too. They're looking at their Kim Kardashians, their Nicki Minaj's, their Cardi B's, their Lizzos, and that's their portrayal of a woman. But then they would have to ask themselves, is this what they want? They might see the makeup and the glamour and the star status, and it could be very enticing, especially for a young individual, because that is what they portray as valuable in their life. But later on, when all the lights are down, when they're left by themselves, what type of mindset do they have? And they might have a really good mindset. They might do a lot of work, but the mentality of how they think or what they portray to the world might not be true too, right? Because if you talk to them in person, they might be a very nice person. But from what they're showing you, it's kind of like, go out, be a boss babe. And you can be a boss babe. But if you want to be, again, looking at the beginning of the podcast, if you want to be masculine, go for it. But then understand you're going to probably need a feminine man. And we got plenty of those. So if you're looking for a masculine man, as many women are, because instinctually, that is what they are attracted to. But if you have a man that can't perform, who cannot operate, why? And it's because he was given this idea of how he should operate. Everything was given to him to make his life easy. If he needs sex, he can turn on a screen. If he needs pleasure, it's at his fingertips. With OnlyFans, anything, he can get his fix from there. So as men, we have to understand that we have to continue to build our value and not simply just be idle. Because it's very easy to go behind a screen and play PlayStation and to play video games and to not take action, be it working out, being creating something meaningful like a business, or helping someone create a business, starting a brand, building yourself up. That is more fun in the long run than playing a video game that you're going to get tired of in a couple of weeks, maybe a month. Yes, you might be a streamer and make a living off that, but understand, if you make a living off that, that might be your 8-hour day. So you might play 8 hours, but what do you do after that? Are you eating fast food and drinking Monsters and Red Bulls? Or are you going out, eating healthy, doing what you're supposed to do? And there's going to be people who are going to be doing the right thing, but then there's going to be a healthy amount of men who are not. That's why there's a small minority of men that get the majority of women. It's because those men, that small minority, chose to be more. They chose to show up. They chose to choose manliness. They chose to choose masculinity. So if you're ready to step into your masculinity, if you're ready to fix any health problems that you're having, whether it be high blood pressure, depression, anxiety, or maybe even looking at the habit part where you're smoking, maybe eating too much potatoes, french fries, too much red meats, we have to learn moderation. We have to learn balance, and we have to learn what works for our body. Because what I find with many of my clients is that they don't pay attention. I help people pay attention to their life, because if you're just going to give yourself a surface level idea of what's going on in your life, you're always going to live on the surface level. But we want to start to dig down deep. How can we start to live more meaningful lives? And not only to our personal health, but also all the other relationships that we would cultivate in our life. We are the ruler of our life. We are the master of our destiny. We just have to begin to take more ownership. And if you're ready to take ownership, you can check out Dr. Truong. Her website links are in the description box below, or you can go to revenconcepts.com, get yourself some mindset coaching, and we can begin that process. Because what awaits you is a better you. So don't allow those results to sit idle too long. My name is Michael Rearden. I'm a mindset coach. If you have any questions, you can email me coachinginsession@gmail.com, and I will see everyone on the next episode of Coaching in Session. Until then, everyone, take care.